Okay, good day. Welcome to the preliminary PPP screening report of Kyadondo Referral Hospital project. This is a project by UMI students of MBA, General Module, General Management Specialization. The module is Public-Private Partnership, MBA 30, Evening Group, D, 4 and 5. I'll go right away to the executive summary. The Ministry of Health is undertaking the proposed Kyadondo Referral Hospital project in the northern flank of Wakiso district through PPP arrangement. The project aligns with the Uganda National Development Plan 4, the Uganda Vision 2040, and the National PPP policy in health. And the private sector will undertake the design, finance, the build, the operations, and the maintenance of the project, ensuring efficiency and sustainable operations. The project is a state-of-the-art 200-bed inpatient hospital equipped with state-of-the-art modular theaters, modern imaging equipment, and specialized health amenities, all aimed at improving healthcare access, infrastructure, and health service delivery. The project will cost $50 million US, with 70% debt financing and 30% from equity shareholders. The economic analysis indicates strong viability with a positive NPV and best IRR of 18%. Value for money of the project is at 16.67 against the threshold of 5%. And the project will be on 10 hectares of unencumbered land in Chitukutu Wakiso district. Those have already been secured. This project posits to ensure healthy human capital, job creation, economic development, expanding of healthcare coverage, as well as to ensure high-quality health service delivery with easy accessibility. I'll call on my colleague, Esther Wabinga, to continue from there.
Okay, thank you. Thank you, Jerome. Under the project description, the Kyadondo Referral Hospital project will be a state-of-the-art 200-bed inpatient hospital with state-of-the-art modular theaters and modern imaging facilities. Will be implemented in Chitukutu Wakiso at an estimated cost of 50 million. The project will run under PPP arrangement and will serve as an auxiliary referral hospital to handle all kinds of general and specialized medical referrals, looking at residents around Wakiso, Luwero, and Mukono, approximately 3 million residents. The private sector will handle the design, will handle the financing, will build, construct, will handle the operation and maintenance of the project, and we hope it will run as a 15-year long-term project. It will be premised at on a level and uniform expanse of 10 acres of land with minimum changes in elevation, which will be advantageous for construction and operations. Over to my colleague, Jackie.
Thank you, Esther. Below are the benefits of the solution proposed: improved patient outcomes, such as reduced mortality rates and higher patient satisfaction, enhanced efficiency and access, risk transfer, whereby some of the project risks shall be transferred to the private party, with infrastructure often reverting to government ownership after the contract expires. Then attracting investment such as private capital, fighting and reducing corruption by having clearer contracts and performance monitoring in place. Suitability in Uganda, there is strategic alignment with the goals of better public service delivery, established framework by way of PPP regulation and national policy and public-private partnership, potential for decongestion of the overburdened public facilities such as Mulago, Kirudu Hospital, and Kawempe, accessibility to over 3 million potential clientele in Wakiso. Over to you, Sanyu.
Thank you, Jackie. By PPP suitability, we are looking at why PPP is preferable to the traditional procurement process. 1, value for money potential. Kyadondo Hospital project is expected to to have a value for money analysis of 16.6% against the 5% threshold, hence efficiency. 2, private sector expertise. Through the private sector, much needed flexibility, agility, and innovation across modern radical technologies will be facilitated, hence improved service delivery. Number 3, market expertise and investment, market appetite and investment. The existence of PPP Act and institution framework provides a favorable investment environment for private operators. The debt financing, for example, for the project will be available with a long payment period of 8 years at a reasonable ratio. Number 4, risk allocation. Whereas the public sector has positively demonstrated readiness to assume political, regulatory, and land acquisition risks, the private partners will be responsible for managing the design, construction, and operational risks, where it possesses its greater technical and managerial capacity. Over to you, Hanan.
Okay, the preliminary financial analysis suggests that the project is affordable within the current fiscal limits. The project will will charge 50% in user fees. It will be supplemented by 50% in availability payments and ensure affordability and profitability at 20% for the private sector player. Then the initial projections indicate the positive economic benefit, manageable contingent liabilities, and the project's ability to be accommodated within the government's current and future budgets constraints. As the project moves from the pre-feasibility to the feasibility and the substantiation study, and tendering stages, a more refined affordability assessment will be developed. Over to you, Remy.
Thank you so much. For the legal and judiciary issues for the project, Uganda's PPE legal framework supports the private sector in participation in health. The sector equally formulated an institution framework under the national policy on public-private sector partnerships in health, and therefore partnership will operate within the existing laws, policies, and plans. The Ministry of Health maintains the overall responsibility for health policy, formulation, standard setting, quality assurance, and regulation of the health care providers. And their accreditation, licensing, and registration for this project will be handled by the relevant regulatory bodies such as the Uganda Medical and Dental Practitioners Council, and additionally the private health care practitioners involved with the registration and licensing of their respective professional councils. Additionally, all service providers will follow the minimum quality standards set by the Ministry of Health, and also the environmental impact assessment, oversight, and enforcement of the Environmental Management Act, that is CAP 153, shall be handled by NEMA. Whereas clear structures are in place for mediation and arbitration of the disputes through the PPP unit, which is under the Ministry of Finance, Planning, and Economic Development. Over to you, Eden.
Thank you, Remy. We are looking at the stakeholder identification and readiness of the project. We have various stakeholders here, like the private investors, the financials, like Standard Bank Group. We also have government and international partners, who include the Parliament of Uganda, Ministry of Health, Ministry of Finance, Planning and Economic Development, and also the general public. We are looking at over 3 million potential project beneficiaries. For the project readiness, we already have 10 hectares of unencumbered land costing $400,000, which has been identified in Chitukuto Chira municipality. The readiness is moderate to strong, pending completion of detailed feasibility and transaction advisory stages of the PPP. We are also looking at the detailed architectural and construction plans undergoing prerequisite clearances from relevant authorities. Thank you. Over to my colleague, Susan.
Thank you, Ida. Information availability for this project has been adequately documented and shared to support informed decision-making and to derive to satisfactory conclusions that will be positive in respect to our screening test. This will be accessible at the Ministry of Finance, PPP unit, and Ministry of Health. Our key information will be generated from the population health statistics, disease burden indicators, preliminary designs, land tenure, and ownership records. These will be the basis to lay a strong foundation for the preliminary screening and financial modeling. Furthermore, we shall conduct an environmental impact assessment, which will come up with a detailed technical design and socioeconomic appraisal analysis. And this will form part of the information and refinement that will be used to come and ascertain assumptions that will confirm the affordability and conclusive value for money assessments for our project. Over to you, my colleague, Roger.
Thank you, Sanyu. Under the project layout, the project will run from 2025 October to 2028 October, which is three years. Under this project, we shall commence to get approvals from the PPP committee, and a detailed feasible study will commence. We shall, a transaction advisor will be appointed to do a further visibility on the missing financial modeling and technical and environmental assessment. The tendering process will be conducted after detailed approval, and subsequently contract negotiation and PPP arrangements signing will follow. Over to you, Andrew.
Thank you very much, Rogers. Our screening tool dashboard, the parameter snapshot is very strong, standing at 5. The preliminary visibility also strong at 4.46, and the risk assessment, which we've undertaken, is also very strong at 4.83. In conclusion, the Kyadondo referral project is justifiable and beneficial approach, and it will improve healthcare services efficiently by leveraging on private sector expertise and funding to supplement public resources. The project can help address budget deficits, provide specialized services, and enhance overall health outcomes by allowing the government to focus on its core strength. Also, for it to be very successful, the project shall be carefully designed to ensure fair risk sharing, transparent procurement, and a clear focus on equitable access for all citizens, particularly the most vulnerable. Thank you very much.
Thank you very much, colleagues. We've cracked it at 9 minutes and 30 seconds.